Go into the didactic piece. Is there anything else housekeeping wise that you want to know? Okay, we're good. Again, anyone who has not said hello that would like to say hello, that we can now see you. Angela, we can see you now, so that's great. Angela Briggs. You can see her. Let's see, who else? Oh, I can see her saying her. She's having some trouble. Technical, okay. Yeah. Okay, anyone else that has not said hello yet? Just doing a quick loop back around. No? Okay. All right, so at this point, I'd like to move into our didactic piece. And again, fortunate to have you with us, Theresa. We are all kind of getting to know each other now at this point, session 4. But again, she's the VP of Quality Improvement for Penobscot Community Health Center. And I believe the largest FQHC in Maine. So certainly grateful to have her expertise and knowledge here with us today. So I'm going to roll this over to you, Theresa, to kind of take it away for our didactic at this point.
Great, thanks so much. So today we're going to talk a little bit about clinical prompts and reminder and recall systems. Next slide. So sort of when we're thinking about developing workflows or adjusting our workflows, sort of the first part in that is to think about how we want to prompt the care team or the medical assistant in this case. And so there are a few ways you can go about thinking about that. One of those is through pre-visit planning. So this is prior to the visit, pulling reports. You can use reports from your EMR. You could pull impact reports. I would recommend pulling an impact report for every visit type, even if it's same-day care, chronic care, and certainly for well child visits. Include the HPV and other adolescent vaccines in that pre-visit planning. It can be done any way you want to think about it. So it could be done and developed through your electronic medical record. And you'll see on this screen here to the right, this is an example of pre-visit planning that is done through the EMR. So there's a sort of a macro or a quick text you can use that identifies sort of all of the care that that patient may need, and then the date that it might have been done in the past. So it's a quick reference for you to figure out if the person might be due. If you don't have that capacity, there are tons of other types of workflows you can develop. So you could do it manually by paper. So to the left is another sort of electronic version Word document that we created for pre-visit planning, that we have for peds, that we have for adults. And so it's just a quick checkbox, you know, the name of the patient, date of birth, and what they're due for. And so you can do those prior to the visit, and that way it preps you for what they might be due for. The other thing I would mention is that you can consider calling ahead to your patients, particularly around immunizations. So as you know, those are the types of visits that people like to plan for, right? So they want to think about it. They want to, if they want to pre-medicate their loved one with ibuprofen, Tylenol, or have the conversation with them ahead of time that they are going to get vaccines, that's an opportunity to do that ahead of time. So they're not making that decision in the moment. Next slide. In addition to sort of after you've done the pre-visit planning, you've prepared for the visit, developing systems or workflows to prompt at the time of the visit is also important. So one of the things I mentioned, you'll hear me mention this when we talk about provider prompts, is that whatever system you choose, it needs to be standardized. And the reason for that is if you have 12 providers in an office and every one of them has a different way to prompt the MA or to do pre-visit planning, if you've got any sort of coverage issues or you have an MA covering for a different provider team, you've got unreliable systems in that case, and it's likely not going to get done. So standardize whatever system you choose. So they can use, you know, they can reference the pre-visit planning sheets at the time of the visit to remind them and jog their memory. They can refer to pre-visit planning, a document they've done in the EMR. And so this is an example here of a pre-visit planning document that says, you know, PVP for upcoming well child needs vaccines. So it's just a quick prompt that I know at that visit they're going to need vaccines. And then if you open the document, it actually will tell you in a case like this what they need for vaccines. So, you know, you can do it through the EMR, you can do it through the pre-visit planning sheets we talked about. Next slide. There are also other, you know, less sophisticated ways. So you can use your schedule to make a little note that says, you know, well child check needs Tdap HPV meningococcal. You can flag yourself. You can use a sticky note, an actual sticky note that you put on your desk or on your computer. You can use the sticky notes on your computer, you know, that sort of software to remind you, and I've got a copy of one below so you can see what that looks like. You can develop task lists in your EMR. I've seen some people very successfully have provider and staff huddles either the day before or that morning, where they just literally print off their schedule and right next to the patient's name and the time they're coming in, what they need. So again, it doesn't really matter what system you have, you just need a system. Next slide. Other ways to prompt at the time of the visit. So this is an example of an actual EMR or electronic medical record prompt that's been created. So in this case, if a patient's overdue for immunizations, it will turn yellow. They can select and push that button, and the second screenshot below shows you what that looks like. So in this case, I know this patient is due for all of those immunizations. So I can select one of those and it will actually sort of make the order right in that moment. So that's an example of an EMR prompt, and you may want to think about developing a workflow or maybe a long-term plan is to have that as part of your EMR. Next slide. Another type of EMR prompt that I've seen is this one, where it actually pops up. There's a little button that you push as well for all overdue care, not just vaccines, but this is one of them that pops up and will give you sort of the guideline and the information, sort of the rationale of why we're wanting to do the HPV vaccine. And in this case, we'll actually show you the dates of those vaccines that were done previously. In this case, you can see it says NA, because they haven't received any HPV vaccines. And then it's what we would consider an actionable prompt, right? So I can order the HPV vaccine, I can document that they declined it, and that feeds into my chart. I can identify that there was a contraindication for some reason, and again, that will populate my chart in that case. Or, you know, if it was unable to be given today, but I've flagged myself for 1 to 2 weeks to do a recall. So just another example, obviously more sophisticated, but certainly something that might work. Next slide. So we've talked about prompting prior to the visit, prompting the MA or staff at the time of the visit, and now prompting the provider. And so again, super important you have a system. It doesn't really matter what the system is. And actually, I did find one article that states that basically doesn't matter what type of prompt you use or location of the prompt, that doesn't matter. They're all equally effective and can actually see a 12 to 14% improvement in HPV rates if you've got one system there. So you can use, again, Impact, a computer-generated printout, a sticky note, a laminated card, and you can see this little screen or icon below is actually an example of a laminated card we use here. We've used it for blood pressure control. So it will say something like recheck BP. And in doing this presentation, I thought, geez, we should make a laminated card for HPV refusal. So again, it's prompting the provider to do something in that moment. And the research has shown that if you prompt the provider at the time when he or she can act on it, it's more likely to get done. So if you're prompting, 6 weeks prior to or 2 weeks, not nearly as successful as if you're doing it in the moment of the visit. So the other thing you could think about is prompting the provider in the HPV of that, HPI of the visit note. So it might say something like, needs all 3 vaccines or needs Tdap meningococcal HPV if you don't have standing orders. So we have standing orders here, so the MA would just give those. But if you aren't using those, you might put, needs all those 3. Or if you've got standing orders and they've refused one of them, like HPV, you could put, refusing HPV vaccine. Again, that is set up as a prompt to the provider to then do something else. And then, super important for you when you're developing this system or workflow to identify who, how, and when to alert the provider and make that consistent so that they can have that conversation. Next step. So reminder systems are really set up to identify those who are coming due, not those who are already overdue, but those who will be coming due. So you can do that by developing a vaccine-only schedule. You can do that for upcoming appointments in general. I encourage you to think about making sure those have confirmation calls, just like a regular PCP visit would, because it's super important to remind them that they've actually got an appointment and that they followed through. You can use Impact to pull reports, your EMR to pull reports, and then your reminder systems could vary, right? So you could do phone calls, which we've talked about. You can use your portal, snail mail, auto dialers. So sometimes you can use confirmation call systems where they can just send a group of people a call that says you're due for whatever vaccines. You could do it by email or text messaging. And again, that doesn't really matter as long as you come up with a system. I would recommend, if you're setting up a reminder system, that if you tailor the reach out to patients ahead of time based on how long it's going to take to get that service. So as an example, I hope it's not 6 weeks to get them in for an appointment, but let's say it is. It's 6 weeks for a provider to get them in for their well child and vaccines. If that's the case, you may want to pull a report for people who are going to be coming due in 8 weeks. Because if you wait until 4 weeks and it takes 6 weeks to get them in, they're already going to be overdue by the time you actually see them. So this is a way to actually keep your rates stable or actually improve them if you're not only reaching out to those who are overdue, but reaching out to those who will be coming due. The other aspect or system you can put in place, or you need to think about the workflow, is in regards to making their next appointment. So you see them for their well child, or you see them for the vaccine appointment. How do they leave your office with an appointment? And that's really something you should focus on as well. And so you could have the MA or the provider make that themselves. If they don't have time or you don't allow that sort of structure, you could send a follow-up slip with the patient to the PSR or the receptionist. So this is an example, and again, I can share some of these if need be, but this is an example of a follow-up slip, and so you can see there where I can circle as a PCP a vaccine and put the follow-ups needed in 3 days or 2 weeks or 6 months, and that ensures that patients walking out, getting their appointment, and they're put somewhere so that we can follow up with them. Next slide. So recall systems. So recall systems are different. These are set up for people who are actually overdue. So we were just talking about reminders and a way to get people and keep people up to date. But if those people fall off for certain reasons, so they've missed their appointments, they are new to the organization and they're already overdue, the type of outreach you do depends on whether they've ever received the vaccine or whether they're super engaged or not really engaged. So recall is targeting this group of people. So there could be other reasons why they're overdue. So they could be on a catch-up schedule. You might have patients who want to do, stagger their vaccines and do it over a longer period of time. There could have been vaccine shortages or delays or missed because of being contraindications for administering that. No-shows and cancellations are another key area for you to think about and make sure you have recall systems for. And again, all of those same examples I talked about for reminders systems apply here as well. So again, you just need to figure out what's best for you and your system when you're creating that. And then I would also just shout out, super important that you train your reception staff and PSRs on the importance of getting patients scheduled for their well childs prior to their 13th birthday, right? So if they know that it's important for 11 and 12-year-olds to be getting these childhood immunizations because they're more effective during that time, if they're responsible for rescheduling, or when someone calls to cancel, or if they're responsible for reaching out for no-shows, if they know there's a reason why it's important to get them in during that time frame, they're more likely to do that and help you maintain their compliance and get them done before their 13th birthday. And then I would just encourage you to think about whether you want to send educational information. Do you want to do it to all outreaches? Are you sending it at all? Based on, Denise's feedback here, they probably aren't going to do that. But, there may be certain individuals that make more sense to send educational information and others who it doesn't make sense. And if you're thinking about the social marketing piece, there's an old adage in marketing and social marketing that it takes 6 to 12 times of hearing information before we accept it or before it becomes part of us and we understand it. So if that applies in a situation like this, we may need to give people education more than just one time, right? We may need to ask them multiple times of coming in the office. We may need to send them educational information over and over and over again before it actually sinks in and becomes important to them. So just thinking about that is important. Next slide. And then just quickly, there is some really good evidence around reminder recall systems. Some studies have shown that, we see some small increases with reminder and recall systems. One study showed that there was increases with text messaging, but not necessarily phone messaging. That there was increases in series completion, but not necessarily the initiation, which kind of makes sense, right? Like if we have to sell HPV vaccination, it might not be as helpful to do it by phone or those sorts of things. They may need more in-person communication about that. And then one new thing I learned that I'm going to think about adopting here at PCHC by doing this presentation was that there was a study in Pediatrics published in 2016 that said preference-based recall is actually more effective than the other types of systems, and particularly in improving completion rates. So this means, you reach out to the patient when they come in and say, I want to remind you or recall if you become overdue to finish your series of HPV. How would you like me to reach out to you? Do you want that by text? Do you want it by email? Do you want me to call you? And that type of recall is actually more successful for HPV than other types of just sort of willy-nilly, like what we've done at PCHC is we just either do it by phone or postcard. So I thought that was super interesting for the group. Next slide. And these were just some of the links that I found, and it looks like we made slides with that. When I was preparing for this, obviously American Cancer Society has tons of resources, but there are other types of resources that are available to you. Pre-made PDSAs that you can use, which were super cool. I thought, wow, I had done all this work. I would have loved to have had these already made for me. But there's a Pediatrics HPV Toolkit that has tons of information. You could spend all day getting in there, but if you're trying to jog your memory on how to do types of PDSAs, some of these are already developed for you. Next slide. And then just lastly, some other links if you're wanting more ideas about prompts, reminders, recall. These were some of the quick tools that I found when doing this presentation that may be of benefit to you and your teams. And I think that's the end.
Thank you so much, Theresa. Awesome presentation, great information and resources.